My name is Andrea, and today I'm going to be talking about airway evaluation. If you are a nurse or an ODP doing sedation or anesthetics, at some point you will have to answer this question: is my patient's airway safe or not? And I understand for a lot of people it's difficult to give an answer because the question is not clear and objective. So today we are going to talk about airway evaluation, and hopefully after this short presentation you will have a clearer view and you will be able to do a proper airway assessment. Is that there isn't one tool that we can use that can give us 100% certainty whether an airway is safe or not. The reason behind this is that the airway is a very complex part of the body. There are a lot of aspects comprehending the airway. So we need to use different tools assessing all those different aspects to have a reliable answer to the question: is this airway safe or not? So we use different tools, and once we have different sources of information pointing towards a direction whether it is safe or not, we can start considering that data reliable. I'm going to teach you a mnemonic that involves all these tools you need to assess an airway. But first, let's think about this. Why do we actually need to assess an airway? Well, without airway, we don't have breathing or circulation, so we don't have life. So airway is our priority, and preventing and getting ready for a difficult airway will help us keep our patients safe from harm. The tool is called Lemon, and the first L stands for look at the patient's anatomy. As soon as you see your patient for the first time, there are certain aspects that you can notice straight away. Does this patient have a beard? Does this patient have a short neck? Is the patient obese? Does the patient lack teeth? These are all aspects that are going to make the airway more difficult. E stands for Evaluate 3-3-2. This is a rule that means 3 fingers between your incisors, 3 fingers between the mentum and the hyoid bone, and 2 fingers between the hyoid bone and the thyroid. Now, I'm not advising anyone to try and fit your 3 fingers inside the patient's mouth. Let the patient try and fit his own fingers inside his mouth. So what we are trying to assess here is whether the patient has a small mouth, or whether the patient has a recessed jaw, or whether the patient has a short neck, because these would all be aspects that would lean towards a difficult airway. M stands for Malampati, and Malampati is a test that should be done with your patient sitting in a chair straight, and you ask your patient to open his mouth widely. Malampati ranges from 1 to 4. Malampati 1, you can see soft palate, fauces, uvula, and pillars. And as you progress to a Malampati 4, you will only be able to see the hard palate. So a Malampati 4 would mean a likelihood of a difficult airway. O stands for obstruction. Does your patient have any blood, secretions, or any tumor that might cause an obstruction to your airway and make it more difficult? And N finally stands for neck mobility, and here we are looking for hyperextension, hyperflexion, and neck mobility side to side. You need to sedate or anesthetize someone, remember Lemon. It's easy to remember and easy to use. It will help you give an objective answer to that question: is this airway safe or not? And it will help you prepare in case of a likelihood of difficult airway. So next time we will be talking about capnography and why you must use it in your sedation practice. So I hope you enjoyed today's video, and I see you next time.